Hello everyone, I am Dr. Rajakumar, consultant pulmonologist. Today our topic is going to be dyspnea or shortness of breath. We will be discussing in detail what are the common conditions, what are the causes, when to approach to a doctor and when to get a treatment, different ways to diagnose. In other way we can call it as shortness of breath. By itself it is saying shortness of breath. When someone have to work rigorously to fill the air into their lungs, or somebody is feeling that they are not able to take enough oxygen into their lungs. So it is a vague discomfort experienced by an individual which will be caused by different conditions. Primarily we will be focusing on conditions that are associated with the respiratory conditions. First, we can go, as many of us are aware of, most common respiratory conditions including bronchial asthma. Second comes to the COPD, chronic obstructive lung disease. So I think these are the two conditions majority of the population are aware of. Those are the major common conditions that can lead to shortness of breath or difficulty in breathing. Then comes few other conditions where we can experience similar complaints, which is shortness of breath or dyspnea, which are including a general pneumonia which is not treated on time, including the COVID pneumonias, any other viral pneumonias, in that case H1N1 and other pneumonias itself, other bacterial pneumonias. Then other condition goes if there is a pleural cavity filled with air or if it is filled with the fluid, which conditions we call it as pneumothorax, when the pleural cavity is filled with air. And there is another condition known as pleural effusion, when the pleural cavity is filled with fluid. So these are the two other common conditions which can lead to the shortness of breath or dyspnea. And then there are few other conditions which are chronic conditions. So chronic conditions, we have interstitial lung diseases, for example, where it is the lung will be fibrosed, and we have post-infective etiologies, such as if any patient with a tuberculosis had structural lung damage, that can also going to lead to damage of that lung, particular part of the lung. If the lung damage is involving more, for example, one or two lobes of the lung or the entire lung of one side is involved, the vague discomfort will be more, which patient usually complain as a difficulty in breathing or shortness of breath. These are the most commonly encountered respiratory conditions that patients usually complain of breathlessness or dyspnea or shortness of breath. Then after respiratory conditions, the major next common cause comes to be from the heart conditions. Heart conditions, for example, heart attack. Second thing is severe LV dysfunction, heart failure, and few arrhythmias. Arrhythmias in the sense where our heart is supposed to beat at regular pace, at regular interval, which is normally we can say it 72 beats per minute. So that beating rhythm, if the rhythm is abnormal, where the heart is beating fast, supposed to beat at 72, if it is beating at 172, we have few other conditions which we usually label it as arrhythmia. So any arrhythmias, if not treated on time, so those patients will also present with similar complaint, breathlessness or shortness of breath or dyspnea. And few other conditions where they have any structural heart diseases. We can say, we might have heard there is a hole in the heart. We usually in medical terminology will explain it as ASD, that is atrial septal defect. We have one more condition, VSD, ventricular septal defect. So we have four chambers in the heart. So top chambers if there is a hole, ASD, bottom chambers if there is a hole, VSD, and we have other structural heart conditions which can involve the heart walls, mitral valve, aortic valve, stenosis, regurgitations. And then, as I told, there is an effusion in the pleural cavity, which is pleural effusion. Similarly, there can be a fluid accumulation around the heart. That condition we call it as pericardial effusion. If it is too much, we can call it as tamponade, which will block the heart to pump enough blood into the body. That can also lead to breathlessness. So what other conditions? For example, there is no heart condition involved, there is no lung condition involved, then what else can be? So if we can go into kidney. So kidney's major function is to filter our blood and to produce urine, to remove all the unwanted things to the urine. So what happens if kidney failure? You might have seen so many patients who are on dialysis. So the dialysis, the machine which is taking function as of kidney. So what the patient had acute kidney injury, where his urine output has reduced, supposed to be 2 to 4 liters according to the body weight. If urine output has reduced so much, so what will happen over a period of time? The fluid which is supposed to be go out, which will be accumulated in the body. So what we usually notice, there will be leg swelling, then there will be edema in the stomach, then there will be full generalized edema all over the body. So now the full body is filled with the fluid. So he will also complain breathlessness. What else are there? Comes to the liver failure. So if there is a liver failure, so there will be a lot of fluid accumulated in your abdomen. So what will happen once there is a lot of fluid in your abdomen, that is going to push our diaphragm above. So what it will do, the lung sizes will be reduced. So that can also lead to breathlessness or shortness of breath or dyspnea. So these broadly we can involve any system, majorly from respiratory system, cardiology, cardiac system, and then come to the renal system, then comes to the liver as well. So today we discussed what is dyspnea and its causes in detail. Stay tuned to the next part to know the symptoms and diagnosis of dyspnea. Thank you and see you in the next video.